Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today we have Neurosynchrony Health. And today we have Tobias and Greg. And we're going to talk about what if your brain health could be measured, mapped, and optimized just like your physical performance. So I had them on today to talk more about the evolution of brain health and how we can start treating better. Greg, if you want to start off, give us a little background on yourself and the company.
Sure.
Awesome. And Tobias, what's your background? Yeah, cool. So you guys said that there's a hole in care right now. So how did you guys come together to create this business ultimately? And what are you guys trying to do to help with care? Cool. So with your services, what all are you actually providing patients that you see?
So I think before you meet the basics, like it's futile to even think about it. Um, we start with listening, trying to get a good picture, trying to figure out what do you actually want to get out of this and what's important to you. Because I might have my opinion, but that might really not be what you want to get out of this. I think it's especially true. We see adolescents, children, right? They come with parents, and parents say, and that might be something completely different than the children's. What's on the child's or the adolescent's mind. And then, like, based on that, based on a good understanding, we can start to think about tools. And
also, just to be clear, so Tobias or Doctor will do the evaluation, right? It use the word psychological evaluation or assessment, like that's an important role here. But there's other assessments that we might do as well. Cognitive assessment. We do an EEG analysis or scans, and then Tobias mentioned the TMS, transcranial magnetic stimulation.
Yeah, as a treatment modality.
Treatment.
I want to say I also really like to reach out to other people in someone's life. I really learned that from working in the emergency room, that when I do that, when I do my assessment, I'm taking a snapshot, and people are old enough to, Shelby, you won't, to remember Polaroid cameras, right? You can take
made a comeback, I think, didn't they?
There's something
Shake it like a Polaroid picture.
Right. So you take that one picture, right? But it's really only that one shot, and you might come out with this weird expression, like, because I just caught you in this one particular moment. So that's my one snapshot, right? What about all the other moments? So there might be a bias there, in how I catch you on that time scale. And so that's why it's so important to put things into context and speak to other people who know you better in a way, like longer, right? Not because I don't trust you, but because I would really also like to know how do your parents, how does your partner perceive you, see that? That's the development over time. So I think it's really important to reach out and to connect. And I think then we could start to think about, like, once we have a better understanding, I think then is a good time to think about, all right, what can we do to help you? And I think we're trying to improve brain health. I want to phrase it like that. We're trying to improve brain health so that you can thrive. That would be really good.
Yeah.
And we have a bunch. We have
a
bunch of things to do that. And we can maybe go a little bit into that. Like, I do not someone on medication or use TMS, there are patients, where we did not think that was necessary, and we connected them straight to their coach, recovery coach, or it really depends on what you.
Comfortable, low profile, flexible, and easy to put on, the Vero ankle brace is simply the best ankle brace for those who move. And that's just about everybody. This brace is adaptable for any phase of injury recovery, whether you're recovering from an ankle sprain, require extra support for your day-to-day, or want to boost your performance. The Vero ankle brace delivers. The Vero ankle brace uses every movement and every step to give you extra boost. The 3-in-1 brace can be worn on either foot, making it the most optimal ankle brace for injury recovery and prevention. The removable stirrups, easy adjust Velcro, and breathable design adapt to your ankle as your strength returns, helping to protect you from re-injury. A dynamic support brace designed by leading orthopedic foot and ankle surgeons. The Vero ankle brace effortlessly adapt to your movements, offering dynamic energy return and support with each step. VeroAnkle.com. Check it out for yourself. VeroAnkle.com. That's VeroAnkle.com.
Greg, what would be your definition of brain wellness in your context of work?
I think the biggest context or definition might be being able to perform like your daily life, in a happy, healthy, whatever you consider normal way. That is truly wellness, right? Like, because everyone's brains are obviously different. You can't. There's no way to compare, mine versus bias or anyone else. So it's, how are you doing relative to like what your normal day is supposed to look like? That's usually how I operate. In terms of how we help people, in terms of how we're assessing people, it's really important to understand that.
Yeah. So you guys kind of talked about the transcranial magnetic stimulation. How do you determine that someone should use that, and what does it actually do?
Well, we can, if that's for you, we can determine that in a number of different ways, right? I mean, in terms of history, this was initially like an anatomic, like a research tool to try and figure out localization and the way networks without having to open up your skull, based on the principle that you can induce a small electric current in nerve cells with a strong enough magnetic pulse. So you don't need to open up your brain. You can do that through the skull and all the tissues in between. And then I recall the story correctly, by doing enough research with that, people figured out, it seems to make people kind of happy, right? And from then on, it went on to be looked at as a tool for treating depression. And that's what it has really predominantly become, a tool for treatment of treatment-resistant depression. So treatment that has not responded to conventional means treatment, such as medication, different medications, psychotherapies that have been shown to be efficient there. A reason for that to be a tool for treatment-resistant depression is not that it won't work for like regular depression, but because initially, or still to this day, there's a cost to it, and a length of time of treatment. It's getting better and better on that end, but insurances have put some thresholds in front of you getting this form of treatment. The latest research does show that for what it's approved, treatment-resistant depression, it actually is better than the other forms of treatment. It does perform better. So again, one way to look at it is, hey, let's look at the DSM, and you're coming, you have all the symptoms of depression. It happens to be treatment resistant. That would be something for you. There's also improvement now for OCD. So sessions and compulsions in conjunction with other forms of therapy. And there's a whole lot of more research out there for TBI, for PTSD, for anxiety, even for hard to treat conditions like borderline personality disorder. And PTSD in itself is hard to treat. So there's more and more coming through the pipeline, and one trend. So it kind of forks up. Like, there's a number of people who are trying to make this faster and the individual treatments shorter. And maybe another trick up their sleeve is to enhance the treatment by pre-medicating with medications that help with plasticity, because we think that that's possibly or likely what's happening. You know, we're changing networks. So that would be one way to look at it.
So the diagnosis. Just to be clear, so the person, one way to know if TMS is appropriate for them is just the diagnosis themselves, right? Like, you do an evaluation where they come to us and they have depression or anxiety or OCD or whatever the disorder is, and that's usually a pretty clear indicator on whether or not it could be appropriate. And then what we do that is a bit different than most other people is we mentioned EEGs before, and analyzing the EEG and understanding how the electrical signals are communicating and synchronized with one another is another really important tool. Because a
Is
person
that
might
the
not.
cap that people wear with the electrodes and stuff, or is that different?
So
that is exactly what an EEG is.
Okay.
The way we do it is a bit different. More, it allows us to do it in a mobile way, right? So we don't have like gel that sticks to your scalp and the cap with a bunch of wires and lines every kind of hanging off of you.
Yeah,
ours is a bit.
It looks a little bit like a bicycle helmet. It still has all the electrodes that you would have in a regular EEG, but they're so-called dry electrodes, so they don't need this gel, and the setup time is much reduced, like really a fraction of what you would usually need. When I was doing residency on the neurology floor, they needed an EEG. Granted, it was an EEG that would stay on. They had a specific person who was doing nothing else, preparing these EEGs, and the setup would be like, now, even with the regular gel electrodes, it'll still take probably like 15-20 minutes to get it set. Whereas with these dry electrodes, you can place this bicycle helmet on. You wiggle around at the individual electrodes so you don't see a good trace, and then you're up to record. We only need to record 5 minutes.
So we could be on the sideline of a football game, and someone get an injury, and we could get it set up in 5 minutes and do a recording in 5 minutes and have an analysis done pretty soon thereafter, in terms of so you understand the speed which we can do it using this technology.
So it goes very fast, and the cool thing about it is we can do some more work with the data that we get. It used to be that you look at this trace of like many scribbly lines, and you look for clear flags that would indicate to you like, whoa, this looks like that person has seizure activity. So you would use it to diagnose or look for epilepsy. You could also use it actually very well to diagnose delirium, but that's not true for most of our patients. They wouldn't walk in here if that was the case. But you can do some more, like some fancier processing with it, and you can do a QEEG, quantitative EEG, and with that, you can ask a completely different question. Well, not completely. You can ask a different question in that you can ask, well, what brain waves was your brain using during this time of recording? Because there is such a thing as neurotypical for what we do, like a resting state EEG. We'll ask our patients to close their eyes, to not think about anything particular, just sit still. And in that resting state, you should see mostly alpha activity, alpha brain waves, which is like an aggregate activity of many brain cells, neurons, at the same time, the same frequency, recurring between 8 and 13 hertz. And you would see that as a nice slender peak, only in the alpha frequency range in your QEEG, and that would be a healthy brain, a well-synchronized brain. That basically means that, hey, this is the radio station, frequency is 98.5 FM, everyone's dialed into this radio station. And as you know, if you're dialed in right, it sounds clear and fine. But depending on what's going on, you might have some distortion. You might have some parts of your brain who are not dialed in. And that's something we could discover doing this QEEG.
And that's what when we do someone who might have like a concussion or something like that, you can pretty quickly see that their brain isn't operating as though it might normally operate, which makes it a really valuable tool in that respect.
Yeah.
So do you guys see this being a somewhat of a baseline test in the future for concussions and then a sideline evaluation tool?
Yeah, we see the potential for that for sure, and we've worked with some schools and for that exact reason, being able to help them. I mean, there's all kinds of different tools and assessments that athletic programs use, but this one seems to be pretty effective in not like kind of almost fail-proof. Like an athlete can't trick it into anything. Your brain is pretty stable, especially in terms of what we're trying to measure. And so it gives us a good, again, using the Polaroid picture analogy that Tobias brought up earlier, is like, it gives us a good snapshot of what that person's brain looks like in a otherwise healthy situation, provided they hadn't been injured beforehand.
So this might be a silly question, but I guess with concussions, it's usually bleeding in the brain, if we simplify it. With your guys' product, I guess my impression was it was the neuron, or neurologically the firing with the frequencies and stuff. So with the bleeding, is it the pressure of the bleed that's causing problems with the firing and all that? Can you go into that a little bit more?
Yeah. So bleeding would be a pretty significant injury. I mean, obviously, it depends on the amount and the location. But that is usually the result of a really severe traumatic brain injury. And so with that, you have a whole host of things happening. First of all, there's a part of the brain that's not going to be well nourished, just that blood flow is missing. So there's an area right after that bleed where, that tissue that comes after that, where that burst pipe is, is not going to get supplied with oxygen. So that tissue is probably going to die. There's a part around it that will probably survive, but it's going to have likely some damage. And it's for many reasons. One is so-called excitotoxicity, meaning you have an increasing amount or an unhealthy amount of glutamate, which is a excitatory neurotransmitter. And when you have a lot of that, there are glutamate receptors that are opening up. And so with that, your neurons are going to be flooded with sodium and calcium. And they're going to suddenly have a really hard time keeping up their normal resting state potential. There's normally a difference between charged ions in and outside of the cell membrane. And when that breaks down, and that breaks down for a longer time, we really get into a host of problems. Your mitochondria might not be working that well. You might have to switch to more inefficient forms of energy creation. So at the end of the day, you might activate a lot of things, including certain enzymes. You might create reactive oxygen species. You might create a lot of things or activate a lot of things to a degree that's just unhealthy and not compatible with the normal life.
So I'm gonna jump in real fast. I think though, Shelby, to answer your question, right? Like if someone has a serious enough brain injury that they're bleeding, they're likely not coming to a clinic like ours. They're probably in the emergency room or in the hospital and getting stabilized from that standpoint first. What we might be more seeing are less severe forms of brain injuries.
So my public service announcement here would be: if you think you have a brain bleed, you should go to the local emergency room, and you should get not an EEG but a CT scan. The CT scan is always really, really helpful in figuring out what can kill you fast and here and now. And if you're clear on that, then we might look into other things. But what I'm saying is, with the EEG, it will pick up the downstream effect of the bleed as well. But it will also pick up much more subtle forms or subtle residues of dysfunction, and something that you might have in a mild TBI when you don't have a bleed, when you weren't unconscious for any long amount of time, but you have lingering symptoms, and you're trying to figure out why is that, and you will have a hard time seeing it on imaging. Definitely not with CT. Probably also not with an MRI. Now you're looking at some really fancy methods like PET imaging or DTI. So like methods that you really need a lot of complicated machinery for. You need scanners and you need places where they can do that. And EEG is really, it's around since the 1930s, right? It's really easy to do. They are getting where you can put it on like a baseball. We're going to see that in the next 5 to 10 years. And so in an ideal world, I would probably want that happening a couple of times as you grow up with your annual pediatrician visit, just to see how your brain is developing. Because you're going to be surprised. When we do our good assessment, we'll ask for times when people might have gotten a brain injury, and you'll be surprised with the catch how many times people have been hit in the head or had an accident. And so then it's really good to try and see, is there still something visible from that?
Now, more than ever, athletic trainers are becoming inundated with the growing volumes and sources of data surrounding clinical injury management. In fact, the purpose of data has changed. Whether it's pre-participation examinations, electronic medical records, concussion management, nutrition, or wearable devices, athletic trainers are constantly faced with new and complicated challenges interpreting data to drive patient care outcomes, reduce injury rates, and show practitioner value. To get ahead of this change, athletic training departments turn to Preventix, a data analytics solution provider. With over 25 years of athletic training and clinical data experience, Preventix empowers athletic training and sports medicine organizations with tools necessary to quantify the impact of care interventions on patient success and outcomes. As a trusted partner, Preventix works with you to build a strategy that addresses your specific pain points, integrating all your data sources, providing clean, reliable data, dashboards, and metrics that can be immediately accessed by stakeholders at the point of care. Don't let messy, siloed data continue to negatively impact your care delivery initiatives and practitioner value. Unlock the power of your clinical data today. Visit Preventix.com for more information. Preventix.com. So you guys do the evaluation, You do the EEG, and then there's the magnetic stimulation. Are there other techniques that you incorporate with your treatments, or is that kind of the primary means to your business right now?
That's a good question. Yeah, I think it can go one of several routes, and then they're not like exclusive. Meaning, what's a good way to put it? A lot of times, people we see already are on medications, and I might have my thoughts on that, but I also want to be mindful of colleagues who prescribe these medications, and I don't just want to change things around without consulting with them and the person who's actually taking these medications. And so, and if I do my treatment, I like to keep things constant. So I would ideally only like to change one variable. And changing medication and then doing treatment, like it gets things very murky. So ideally, I would like to treat with TMS while someone is stable, keeps their medication stable for that time. And if we have to wait for a little bit, then we have to wait for a little bit. But ideally, I'd like to keep that stable.
So the medication is one component. Another component that we might use in addition to TMS could be cognitive remediation, as we talked about before, and that's more intended for addressing like core cognitive domains such as processing speed or attention or work memory or some other areas. When necessary, we might do that, and then other traditional like coaching or psychotherapy might be something that they need. So in an ideal world, a person isn't just getting one treatment, right? Like we're not a silver bullet. Our brain, neuroplasticity in general, the whole purpose of it is right to create new connections and try to rewire the brain as best we can. So doing that with many modalities is really what we're aiming to do.
I think what's also important to add is that TMS is not just one treatment, right? There are different. You can choose different locations. You can treat with different speed, meaning the frequency of magnetic pulses. You can do something like synchronized TMS, where we determine with the EEG what is your individual alpha frequency, like what is kind of like your natural alpha rhythm, and we treat at that frequency and try to get all the cortical neurons in line this way. And there's actually some good research to show that if you use that frequency, it gets easier that way. We can get away with lower pulse strength, which makes it a bit more, I guess, tolerable, even though it's not a painful treatment. I always compare it to a little woodpecker tapping on your head, which, thinking about it, might seem not so great, but it's really, I've done it myself. It is very powerful. But what I'm saying is that you can really shape it to what you want to target. So we can use different locations to different access points. We can use different speeds. We can also try to increase your brain's ability to change, like long-term, by increasing so-called long-term potentiation. So we can give medications just in a small dose, just once before treatment, to actually boost this process. And that's all. Some of that is already officially approved, and has the seal of FDA and insurances. But there's also there's more where I do think it has enough good information, data, and people doing that to justify using it. Especially because the drawbacks of TMS in particular are very minimal.
So you guys have talked about the medication, and you are neutral, I guess. Could you see the EEG possibly help in dosing the amount of prescription for the individual? I've always wondered about that, and I know they had the show where she was doing the blood testing to figure out, the different pathologies and all that stuff with one drop of blood. Have you guys explored that at all? As you just had talked about, was giving them a little bit of the medication before they do the EEG, and could you see maybe if it's doing a study on them to figure out, well, is this too little medication, is this too much medication, can we try to get a proper dosage off of it? That just came to mind. Sorry, I had to ask.
Great question.
And that's well thought about and looked into for sure. I just want to jump back one time. The medication we would give is before the treatment, because during the treat we try to increase your brain's willingness to change, I guess. And so we would give this before treatment to monitor like the therapeutic dose of the psychotropic medication. I mean, we used to do and still do blood levels, which is okay. There are definitely drawbacks to that. It's not so immediate, right? We're measuring the blood, but then there's the blood-brain barrier and like what actually ends up in the brain. So it's not an immediate correlate, probably good enough for what we can use it for. We also do know that psychotropics affect these EEG measurements. You can see shifts in that, like a stimulant, Adderall, might clean up your QEEGs so it looks more neurotypical, and it's kind of like an indication and showing you how that works. We know that SSRIs have an effect, and kind of know where that's going, what they shift. We're not using, it's not officially used yet for monitoring drug treatment. I would say what we use it as is like, I'm trying to get a better idea of like, is what I see, is that you and the problem you're facing, or is there a way that you being on these medications is at least contributing to that change? Or let me put it in another way. Where I definitely see that this is important is with drugs, with recreational drugs. And interestingly, using a lot of recreational drugs, including cannabis, makes your QEEG look a lot like that of someone with mild traumatic brain injury. So there's a lot of slowing going on.
Interesting.
Which, being high on cannabis is not really something that makes you speed up or, like be, the fastest, snappiest thinker in the room. At least that's my experience. But so drugs do have an effect, and you can, again, it's not sharp enough yet to monitor, for example, for sobriety, but we do know that they exert a detrimental effect, and we can show it to you, and we can treat that actually.
Gotcha. Well, when we were doing our back and forth through email, I had brought up the movie Concussion, and this kind of sparked back to that question of, you guys are seeing this as possibly a baseline for concussion testing, and then possibly for evaluation screening post head injury. With the treatment of the magnets, since NFL, they have an accumulation effect of micro traumas. Could this be, with the magnets, somewhat of a preventative treatment to an effect, or help decrease the scarring of the brain?
There's two components to this. I'm going to take the non-medical part because I know Tobias has a lot of stuff to say. I think that the short answer is, the short and maybe not so complicated answer is, the Department of Defense has been doing a lot of work on this and trying to understand micro traumas, because operators, right, special forces, or soldiers in general, have lots of micro trauma as a result from concussive blasts and even shooting a weapon can cause that. So and it's having a major impact on armed forces. So there's been a lot of work done on both the understanding in terms of evaluating using EEGs and other methods to see what's going on there, but also specifically using TMS to treat it. And is it being used in a preventative manner right now? That's really hard to say, although we do know that there are a lot of positive benefits from doing TMS when there's not anything in particular called wrong, right? As an optimization tool. But I think that answers your question, right? Like, so microtraumas definitely affect the brain, and this is a tool that is being actively studied and is actually near. Have been FDA approved yet or not approved yet, Steve?
It's about, not yet, but it's about to happen.
It's very close
this year.
Okay.
I think in terms of prevention, a couple of months ago, there's a review by Andy Galpin about nutritional supplements you can take to prevent, maybe treat traumatic brain injury. There's a whole review about that. And I think the advantage of, for example, using a supplement or a medication is that it can prevent you as you need it while it's happening, right? You could for a lot of those creatine, NAC, magnesium, omega-3 fatty acids, they're probably healthy for regular folks, even without doing sports or being athletes. I would make that jump. But they also seem to have enough studies to support that they are at least helpful in mitigating brain injury, preventing any mitigating the effects of brain injury. And the good thing is you could literally take it before the event, before you go and play your game.
Mm-hmm.
And I think it's probably at this point more feasible to pop a number of supplements than to get your TMS treatment done. If I was facing that situation, if I was an athlete right now, I'd probably supplement based on that data. I probably would get an EEG assessment. I mean, I already have one, but I would probably use that before the season or once a year and track my brain health that way.
And do the treatment after an injury.
And to the treatment after an injury, I probably still debated as to when you want to start. I'll probably hold out for like a few days rest and then measure, probably then treat. That's how I would do it, probably.
So you do a baseline preseason and then a post-exit participation exam, and then you could make some assessment on what the postseason should kind of look like. Would that be the optimal kind of setup, I guess?
Yeah, I would I would do pre and post, and then as needed, right? If we do have, if you think like, yeah, I think I fell here and think I hit my head, or I don't feel, I would just measure. I would just, Again, we're probably not the ones to be right at the sideline. That would be someone in the team who's trained to do that. That's very valuable as it is. You don't need to be a full MD or neurologist. To be that, you can definitely do some of the assessments with reasonably good quality. And again, the EEG is hard to be fooled. Your desire to get back into play will not fool it, and it's a good, more objective measure. It's a very good supplement to put into the mix and make your decision based on that.
Gotcha. So right now, I'm assuming you guys are more brick and mortar, people are coming to you. How are you guys expanding this to the sideline at this point?
So the big part of this is building relationship with schools, primarily high schools, who are definitely noticing that there's a need for a comprehensive and but yet relatively fast and kind of logistic friendly or operationally friendly ability to measure athletes and keep the student athletes safe. So we've been building those relationships and working with schools directly. And I mean, this is a relatively it's a localized thing. Like, you can't necessarily do this from the New York City area and go all over the country. I guess in theory you could.
I mean, the EEG would be something that is actually, you can do that from the car. It is not that, but you need the headset, right? And those headsets are not yet so widespread that they are around in any at any school, and maybe at some bigger schools and some bigger NFL outlets for sure. But yeah, not available all around. But we could travel with that, like especially if there's really a high risk sport,
And
like
we do, yeah.
it would be a good idea. Definitely feasible to go to the actual game tournament.
Raise the bar in 2025. Complete your BOC certification maintenance requirements early. Don't forget that 2025 is a reporting year for athletic trainers. Are you on track to complete your BOC certification maintenance requirements? Find out today by logging into your BOC profile at bocatc.org/BOC360. That's right, it's time, and this year is the year to renew your certification maintenance requirements. Check it out at bocatc.org/BOC360.
Because how much are the EEG's helmets going for right now? If somebody wanted to implement
Tens
into
of
their
thousands
athletic
of
training
dollars,
program.
yeah.
Between 20 and 30.
And
Okay.
and then I think that cost is one thing, but I think the other prohibitive factor is I don't think you can purchase one unless you're a doctor, right?
No, you can. I think
can?
you can. I mean, you could purchase one, but then the next problem that you have, you need to be somewhat computer savvy. Oh, that too. But you need to be somewhat computer savvy to do the data processing. We have a researcher who's able to do that. And so I think we could probably figure it out, but it would be a good bit of time and effort, and having someone who is an expert in doing that for a living and can pull this off in a couple of minutes, just so more efficient,
Yeah.
But yeah, that's it's still, in theory, it is, I think, more cost effective than MRIs and even CTs, because they also need someone to do the read. I think probably in the next couple of years we're going to see with AI a lot of help in getting those reads done faster, even more precise. It'll be good for average, and it's a little bit like automatic reads on an electrocardiogram that you get with the machines are right now. If you see the electrocardiogram printed and it says normal sinus rhythm, it's most likely okay. Right? They're good with the clear-cut normal cases. When it comes to any abnormalities, you still need the human.
Yeah, definitely. So what are some misconceptions on brain health that you guys see?
We'll start with that.
Yeah. Some, I think the biggest, on brain health or on treatment. So
Either or.
Brain health, I guess, in general is, I think the biggest misconception is that there's a straight line or a connection between how your brain is performing with your innate ability, or aptitude or IQ. That's where I think I see the most is like someone thinks they're stupid because they're not doing well on whatever performance test, or they're not able to quickly do whatever is being asked. And that doesn't always that normally doesn't go together. Normally the true answer is a lot more complicated, and your brain isn't working optimally potentially for lots of reasons, and many of those reasons you might have no idea, until you get kind of a better understanding of exactly what's going on there. And we've worked with people who might say that they thought they were stupid for such a long time or whatever, and they're actually one of the smartest people in the room most of the time, but their attention is so bad that they weren't able to kind of pull it all together to show everyone else that they were really smart. So it's things like that. When I think of brain health, it's like there's something that it's just connecting it to being smart or having a really high IQ.
Yeah.
I think for me, the biggest misconceptions are like treating the brain as one singular organ, in that it's connected. It's a centerpiece. It's connected. It's hard to thrive in any way without a brain. And so treating it accordingly would be really, really helpful. It's also maybe over-reliance on. There is an over-reliance on medication. Again, I see medications that are useful tool, and just as that, as a useful tool. And it might be working very well for you, and that's fine. But it might, the same medication in the same kind of DSM labeled condition might not work for the others. And there might be a number of reasons for that. And I think if we rely too much on just one tool, it becomes a little bit difficult, right? As a craftsman, you can maybe build things just with a hammer, but it would be much more helpful to also have a saw and a screwdriver and, and nails and all that stuff. So it's good to have a number of tools. And I think that got to meet the people where they're at, and what their preferences are. I in a way, I often see myself as a brain health consultant. As a consultant, I'd like to give you my opinion, but at the end of the day, you have to, for example, take the medication. So you have to be committed to be doing that. You're paying the price. So in paying for it, but also in potential side effects. So the same with TMS. You got to be committed to it. You got to be willing to come up, show up, get the treatment done, and feel that little woodpecker on your head. It's so it's really important to try to be as precise and tailored to the individual as you can.
I want to add one thing that it was just kind of didn't occur to me, but realized to be important to understand, and that is like in our society, right? Like people want the quick fix or want the isolated solution, and Tobias is really hammering in is our bodies and our brain in particular is so dependent on all these other environmental factors and triggers, and oftentimes patients will come and there'll be an issue, and sure we can help get them better, whether it be depression or concussion or whatever the case is. But one of the first things we do is do some education on what are the other factors, environmental factors that they need to do in order to help this whole process, like get a better sleep habits and regimen, better nutrition, and if all of these things happen, we're going to be more likely to see a positive outcome. Get more likely to get the desired positive outcome. But you can't just expect to come do treatment and continue to smoke pot and stay up till 3 a.m. and get horrible and eat really horrible and try to get better, right? You have too many kind of other factors.
Yeah. So you guys are in the New York area. If people wanted to get treatment or evaluation, that's where they can find you. Are you guys expanding outside of the New York area anytime soon?
We are in the New York metro area. We're in Greenwich, Connecticut, and anytime soon is a loaded question. So the goal would be to continue to grow and grow beyond this particular area. But as of right now, we're gonna continue to support people here and this be our home base.
Yeah. I mean, as much as scaling is desirable, I also think that there's it has to be a really thoughtful process, because I think a lot of that we develop organically and figured out together. It's not that we can't replicate that, like, I mean, I always say that I'm replaceable, like it's someone else will pick up the slack in the emergency room. But that said, I do have I think replicating that and scaling that needs really some time and shouldn't be done precautiously too fast. So I think right now we're pretty happy where we're at.
Mm-hmm.
I like the local community and the people we have who are working with us that we can refer to that are really good at what they are doing.
So how does somebody find you guys or find the same treatment somewhere else?
There are a number of ways you can do that. If you are interested in something like synchronized TMS, you could Google Wave Neuro, and they have a bunch of different providers clinics who are doing this treatment in various cities all over the US, and we can maybe get you a link for that.
Okay.
For regular TMS, depending on where you are, I sometimes overestimate the availability of services because I'm a little spoiled by New York and the stereotypical high frequency and number of shrinks or psychiatrists. And I've learned that is not the same in other parts of the US, for better or worse. So you could go to the website of the TMS Society and look for local providers there. That's one way to do it.
Those are probably the two biggest things or most helpful things. I mean, the reality is there aren't many other providers that are offering the level of services that we're kind of offering in house. Hence to one of the first questions you asked, why we're doing this.
Yeah.
We're trying to be able to really focus on brain health. When you talked about cognitive remediation, I was trying to think of who you could find to do cognitive remediation. And outside of the New York City area, there really aren't too many people out, other than pockets of academia.
Well, that's where I was like, are you guys expanding? This is needed, but how do people access this?
Yeah. Well, here's a good thing though. With some of the treatments being really more condensed in terms of time, again, for treatment-resistant depression, they are putting a one-day treatment in place. So literally 1 day of treatment, and you're done, and you can see the effect kicking in over the next days and weeks.
Mm-hmm.
So that puts it into reach to even travel for a day, even from further away. So you can start to make a case for that. In general, what I would recommend, just get a feel for the place. Like when you speak to someone, see if they listen, see if they're trying to come to a plan in a collaborative way. See if they're trying to push is the wrong word. If they have only one tool to sell, it'll offer you, like, well, ask about alternatives.
Mhm.
Right? And it may be that they're completely right, and that is the tool to use, but a good assessment plan should also have the alternatives, right? What are other things you can do in a realistic assessment of, like, what would that do and how successful is that?
Yeah.
If you feel like, all right, I think someone is really interested in my story and what I'm dealing with, and they're trying to get a plan together that's based on my needs, I think then you're at a good space.
Yeah. Well, is there anything else you guys wanted to add before we wrap up? I think we hit a lot of things.
This has been a great conversation.
Yeah.
Good.
And apart from my inability to get the headphones working for the first 20 minutes, I think we've been successful. Amazing.
We made it work.
Yes, we did. We did. Yeah, thank you. That was very enjoyable, Michelle. We appreciate you giving us the opportunity to have this conversation. Thank you.
Yeah. And if anybody wanted to reach out to you guys, how's the best way to do that?
The fastest way is to go to our website, neurosynchronyhealth.com.
Okay.
And our contact information is on there, and they can fill out our contact us form or email us directly, whichever is best.
Or even call us.
Or they can call us.
We still do phone. We pick up our phones.
That's right.
Is it attached to the wall?
No, actually, it's not. I don't think any phones are attached to the walls.
I've been thinking about it.
We should mount one just for fun, though.
Yeah.
No, but you will get one of us.
Perfect.
Likely.
Well, I just know that there's a lot of athletic trainers in the concussion space, and I feel like this would be a great connection for you guys all to work together. So I wanted to pitch that ultimately.
We welcome people being curious and having questions, so that would be amazing.
Perfect. Well, thank you so much for being on. I hope to have you guys on again in the near future. I'm hoping you guys figure out how to make this compact to be on the sideline. Yeah, that's the next step.
We'll work on that.
That's exactly right.
Okay.
Perfect. Well, thank you so much.
Thank you, Shelby. Bye.
That's it for today's episode of To the Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To the Bone podcast is a product of Daily LLC. It is hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.